My name is Rose Munge. I am a pediatrician. I'm a pediatric hematologist and oncologist. That just means I treat children who have diseases of the blood and cancer. Yes, I work at the Kenyatta University Teaching Research and Referral Hospital as the head of pediatric oncology.
How long have you been in the space in terms of dealing with children?
Have been working with children from about 2010 actually, but I did my specialization from 2015, and then I went back to school to specialize in oncology in 2021.
Since you've been in the cancer space for close to 16 years, what are some of the statistics when it comes to children with cancer in Kenya and probably globally?
Globally, the numbers are at about 400,000 children per year who are diagnosed with cancer. In Kenya, it's at about 3,000. So between 3,000 to 5,000 children per year diagnosed. That number is not specific because there are a lot of childhood cancers that look like other illnesses. So the numbers could be a little bit higher. But generally, it should be in the range of 3,000 to 5,000 per year. Yeah.
And speaking of statistics, what are the most common cancers and probably the rare cancers when it comes to children?
Okay, so cancer in children is already a rare disease. So that needs to be clear. But when we are looking at the types of cancers of these rare diseases, blood cancers, leukemias tend to be top of the list. And then closely following that is brain tumors. We see a lot of children with brain tumors. And then now the others, kidney tumors, tumors of the liver, tumors of the bones, all those are also there. But the most common, blood cancers, brain tumors, and kidney tumors.
When it comes to children, what are the signs and symptoms to look out for a child to be diagnosed with cancer?
The thing we always tell parents is to look out for illnesses that they look like other childhood illnesses. For example, fever. Fever is a very common thing to see in a child. A child who has a throat infection will have a fever. If they have diarrhea, vomiting, they'll have a fever. If they have an ear infection, they'll have a fever. But the difference is you will have fever that has gone on for a little bit too long. So you see parents who have gone to hospital several times. Child has fever, is constantly unwell, they have weight loss, they are not as active as they used to be, so they are tired. They start looking pale, like when you look at their hands and their eyes, they look like they don't have enough blood. And then you go to hospital, some of the numbers that you're seeing are not good. Maybe it shows signs of low blood, shows signs of infection. You get medication, you go home, but it seems to be coming back frequently. So that's for the blood cancers. If you're thinking about brain tumors, is a child who will start saying they have a headache, or they are staggering while they're walking, they're sleeping longer than usual, or they start having convulsions, seizures. So if this starts happening, or if you see one side of the body is not behaving like the other side of the body, then you start thinking, is there something else going on? For other tumors is you'll see swellings of the belly. Like for the kidney tumor, you're washing the child, you find that there's a swelling that wasn't there before. Even if it's painless, there's no pain, there's nothing else, the child seems happy and active, that should trigger you to take this child to hospital for further investigation. So it's usually things that look like another normal childhood infection, but that has stayed a little bit longer. You've gone to hospital, you've been given medication, it's not getting better. So you keep going back to hospital. And if you go to one facility and you're getting the same treatment, you change. You go to somewhere higher, somewhere different, and perhaps that is what will pick up what is happening.
So my question would be, at what point then would a parent seek medical attention?
So of course, because most parents will not sit at home with a sick child. If you've gone to this fever, this vomiting, you go to hospital, you get medication. You don't get better, we go back. Yeah, you keep going back until you get the solution. Like I said, it's a rare condition. So most of the time what you're dealing with will be the infection. and that will be cleared out by antibiotics or other medication that you're given. If that does not happen, it has been 2 weeks, 3 weeks, a month of the same thing happening over and over, that should make you a bit more vigilant.
What are some of the different forms of treatment for different types of cancers when it comes to children?
Depending on the type of cancer that is present, there are different treatment modalities. So there are some that chemotherapy is enough, that you will give this chemotherapy in various forms, orally, through the IV, and that will be enough. There are others that you need a combination of chemotherapy and surgery. So for example, if it's something for the kidney or the bone, then you need to bring in the surgeon. You do surgery as well as the chemotherapy. There's also a third option called radiotherapy. Again, depending on the type of cancer that you have. So sometimes you get 1 or 2 types of treatment, sometimes it's all 3 of them, depending on what type of cancer we're treating.
What kind of side effects do children exhibit when they go through some of these different forms of treatment for cancer?
Okay, so like all medication, they have side effects, just that sometimes their side effects look a bit more dramatic than other medications. So for some children, there will be a little bit of an increase in vomiting. They don't feel like eating as much. But we give medications to help with that because we anticipate it. It can put you at risk of infections. So we usually tell parents of children who have cancer to be very, we teach them about what to look out for and make sure we're cleaning our hands, the types of food we're eating. We avoid crowds, big crowded areas. Sometimes we pull the children out of school for the season that they're on treatment before they are allowed to go back into school. We put them on some antibiotics sometimes because of the risk of infection. For a lot of them, will need some blood product support. So they will get some transfusions over there. They will get some platelets. So depending on what we are treating. Okay. Some of them, and I know this is what most people see, you lose the hair. Okay. So the hair will go, but the hair grows back. Okay, after we've completed treatment. Sometimes you see changes in the skin, changes in the nails, but all of this usually tend to reverse after you've finished the treatment. Some medication will have some long-term side effects, and then we monitor that over a long time. So that is a conversation we have with the parents, and for some children, the ones who are old enough, like the teenagers, we explain what the side effects are and how to mitigate them. Yeah. We have that conversation as we are starting the treatment so that they know what to expect.
Still on treatment, what are some of the misconceptions around cancer treatment?
I think the one I've had the most, a lot of people think children don't get cancer. So that is the first thing that we say. Children, you can get cancer from any age, from the time you're born all the way up to, if you grow to 100 years, during that time there's a chance of getting cancer. And the older you are, the higher your risk. Yeah. The other misconception I get a lot is that once you have a diagnosis, that there is no hope. But for children, the chances of cure are much, much higher than for adults. But it does depend on the kind of cancer it is that we are treating and the timing. So the earlier we find it and start treatment, usually the better. And there are a lot of children who have gone on to be treated fully. Actually, out there in those first world countries, cure rates are up to 90, sometimes 95% for some types of cancers. Okay, so our numbers here are not as good, but it's usually because by the time they come to someone who knows what's going on and starts treatment, it is late. But cancer is curable for children. Let me see which other one, that they will not be able to continue with their life as normal. That is not true. Because once you're done, it's like any other illness. When you have malaria, in that moment of malaria, you're quite sick, you're probably not doing your normal duties, you're not going to school. But once it has cleared, you go back to your normal life. And the same thing happens with cancer. Yeah.
Let me ask, for children, is there a point they probably get to a state of remission?
Yes. So that is the aim for
The treatment.
The treatment.
Okay.
We don't like using the word cure too early, because sometimes there are some that will come back and we will have to do the treatment process again. So for most, you want to get them into a point of remission, and then after that you follow up someone for, I think for children we follow up for about 5 years. And then at that point, after you've been cancer free for 5 years, we say, oh, now you're cured. Remission just means that when we look for the cancer, we are no longer seeing it. For example, there was a blood cancer. We've given the treatment. You have finished it. We've done our tests. There is no cancer. And so you're in remission. And then you give that some time, because for some of them, sometimes they do come back. So you give it a little bit of time. You're following up outpatient. And once they get to a certain place, then you think the chances of a relapse are not as high. And at that point, we can talk about a cure.
What would cause a relapse?
It's difficult to explain, to fully explain. Some of it is that the type of cancer you had was quite aggressive. Some of it is it probably never went completely into remission in the first place, so it just resurges. Sometimes it's just that the genetics that you had was predisposing you to a certain type of cancer. So it's not, you cannot predict of this one will go into remission, this one will relapse, this one will get a full cure. But we try, you give the treatment, and for a good percentage of those, they'll go on to get cured.
How often should a parent take their child for checkup after being declared
cancer-free?
Yeah.
It depends on the type. But generally, for most, once you finish treatment, the first year we tend to do more frequent reviews. Every 1 month for a season of a certain number of months, and then once every 3 months, and then once every 6 months. And then at some point we switch it to once a year checkups. But it does depend on what kind of cancer. So depending on what it was, then your care provider will tell you how frequently to come in for reviews.
Since you deal with children, would you say they experience stigma?
I think stigma is everywhere in chronic illnesses, and cancer is sort of a chronic illness. They will experience stigma from other children. I mean, your hair has fallen off, your nails have changed, perhaps you don't look the same as other kids. So sometimes, yes, they will experience stigma. From the community, like I said, sometimes there are misconceptions that it is tulirogo, yeah, and that it has come from someone looking at you badly or things like that. And sometimes when people have no knowledge of these things, they now think it is something that is contagious, which is not. All of that is stigma. Yeah, so we are working hard to dispel some of those myths, to show people that they will get the treatment, they will be cured, they'll come out of it and they're fine, and it's not contagious.
So in terms of treatment, aside from the normal treatment child will get in a medical facility, what other supports can children get when it comes to cancer treatment?
The treatment of childhood cancer, and all cancers in general, is has many facets. There's a medication part, and the part that the doctors will play. There's a part that the nurses play, they're giving the medication and making sure they're doing well. There's a psychosocial support, okay, which is where organizations like Faraja Cancer Support Trust will come in. There's a nutritionist support. We need balanced diet, healthy diets to get the children through these cancers. There's physiotherapy, there's counseling, there's play therapy. There's a lot that goes into treating a child with cancer, because remember, they are still children. They still have to go to school, they still have to get their education. So organizations like Faraja Cancer Support Trust, they have given a lot of support. The major hospitals treating, public hospitals treating cancer are Kenyatta University Teaching Referral Hospital, Kenyatta National Hospital, Moi Teaching and Referral hospital. And in all of these places, Faraja has come in to support the children. They support the parents, the caregivers. They give a lot of psychosocial support, counseling sessions. They will bring play dates, like for the children in the wards, bring them toys, bring them colors, books. They will, because cancer is a very expensive treatment, they also do offer some support. They pay for certain children SHA, and then that way the child is able to access treatment. So they do a lot of work in the background that as much as I give the medication, all these other things are necessary to help the child be well in a wholesome way. Yeah. So that is where support groups like that, they bring in parents, caregivers, and just have group sessions with them so that they also have support. They do a lot of education in the communities as well about what this diagnosis means. Yeah, so they and we cannot work without them, to be honest. Yeah, we need the whole team to work together to get good outcomes. Because if I have the medication, if mentally you're not supported, it affects treatment. If nutritionally you're not supported, it affects treatment. So all of this work together to allow the children to have a much better experience in the hospital, and that usually ends up being seen in the outcomes that the children have in the long term.
And then with the advent of artificial intelligence, what role do you think AI would play in cancer treatment?
So I think where it helps a lot is when it comes to diagnostics, when it comes to identifying exactly some of the genetics involved, and then that way you can tailor the treatment a little bit better. And so out there they're using a lot of AI to narrow down almost to the genetic component that's required. Here we are not yet there, but it does help. It helps to have AI looking at the medications that you have. Are they going to, is that combination, what's the best combination for certain things? So some of that is where the AI will come in to help with it.
Okay.
Yeah.
What advice would you give parents who are living with children that have cancer?
I mean, I think everyone in the pediatric oncology world, what we say is that there is hope. Like, it is not a death sentence. Like I said, 90, for some of them up to 95% chance of cure. If it is caught early, if you're taking the medication as prescribed, if you're getting your regular follow-up, there is such a big chance that the child will be cured and will go on to live a normal life. Yeah. So don't lose hope. It's a difficult journey, and we acknowledge that. It's an expensive journey, we acknowledge that. But in the long run, you're giving the child a chance to come out the other side and live, which is what we always hoping for. So take heart, enroll in programs like the Faraja Cancer Trust, the patient support groups, talk to fellow caregivers, get a lot of support in that area, and before you know it, you're out of it. Yeah. So there's always hope. There's always hope.
We're in September, and September is known to be Gold September. So what exactly is Gold September all about? So
September is internationally recognized as the Childhood Cancer Awareness Month. So we take this time to create awareness about childhood cancer, that it exists, that it can be cured, where to go for treatment of these childhood cancers. We use the month to celebrate the warriors who have been going through the cancer treatment and coming out on the other side. We acknowledge the caregivers, the health workers, all the support people who work to improve the lives of children in cancer. Yeah, so Gold September means we're raising awareness about childhood cancer and all that entails. And so to that end, you remember I had talked about Faraja Cancer Trust. They are having a run, on this, I think on the 20th?
20th of September.
20th of September. They are hosting a run where people can join the run with them, have some fun, 5 kilometers, 10 kilometers, 21 kilometers, have conversations with children who have gone through the cancer, have conversations with caregivers of these children, have a conversation with the Faraja and find out exactly what they do to support people living with cancer. And they don't only support children, they also support adults. So I think that it's a good opportunity to interact with them and see the good work that they're doing as well.